Hi there, I'm Erin, one of the faculty members with the Temple College EMS Professions program. This video is designed for individuals who will spend time mentoring and teaching our students. In this video, I will explain to you a little bit about the goals and objectives of our students, as well as show you the paperwork that accompanies our students on their clinical rotations. Our students are preparing for a career in the out-of-hospital environment, so you may be wondering why on earth would they be spending time with you in an ICU, a cath lab, or even a dialysis center. Each of our students' clinical rotations has a purpose and objectives. These objectives can be found in two different places. First, the student's paperwork that he or she carries with them. This is the paperwork that you will be asked to sign at the end of each shift. The very front page of their paperwork lists their goals and objectives. The other place you can find this information is in the hospital clinical manual that our department has produced and provided to each department where our students rotate. Generally speaking, the primary goal of our students is to see patients, watch and perform assessments, including a hands-on exam, and learn about as many different pathologies as possible. The secondary goal of our students is to practice skills such as IV access, drug administration, and intubation. Please note that the skills that each student may practice will vary depending on where they are time-wise in the program. Let's take a closer look at our students' paperwork. The students will bring paperwork with them on each rotation. The color of the paper will vary depending on which class the student is taking. The front page includes information such as objectives and goals, as well as contact information for the clinical director and program faculty. When you open the paper folder, you will see two separate evaluations for the student. One evaluation is an affective or behavioral evaluation. The other is a clinical evaluation. Both evaluations are extremely important to us as faculty. We ask you to score students in several different categories, as you see here. On the right-hand side of the page is an evaluation of clinical skills. If you did not witness a student perform a particular skill that's listed, please circle NBE, or no basis for evaluation. Please only circle the highest score if you feel comfortable with the student performing the skill in an actual clinical setting. Below this section is space for comments. You may write whatever you like here. Every single clinical document is reviewed, so any comments left will be read by faculty. Below the section for comments is a signature line. If a student fails to obtain your signature, their rotation will not be counted toward the completion of their clinicals, and, most likely, you will see them again on your next shift desperately looking for your signature. The student is responsible for filling out the back page of the form and has his or her own opportunity to comment on the clinical site. The student is not required to complete this form prior to obtaining your signature. We appreciate the time you take to evaluate our students accurately. Without appropriate feedback, we are unable to help our students create plans for improvement. Your input is truly important and matters to us. Thank you for your honest evaluation of our students. Now I'd like to introduce you to our hospital clinical manual. You may find this document on shelf in your department or perhaps in a supervisor's office. This document is also available on our website. This manual has detailed information regarding items specific to your department, copies of skill sheets, and further information regarding student paperwork. If you have not yet located a copy of this manual in your department, check with your supervisor to see where it may be located. And if you don't have a copy, please feel free to contact us, and we're happy to provide it for you. Thanks again for teaching our students. Your role in their education is vital to ensuring a competent next generation of pre-hospital healthcare providers.